Hello everyone. We all know that nutrition plays a key role in keeping us healthy, and the upcoming National Nutrition Week is the perfect occasion for all of us to learn how good nutrition can equip us with strength and immunity to fight COVID-19. This Sunday, that is 30th August at 11 a.m., join us on Apollo 24/7's Health Hour, where two senior doctors from Apollo Hospital are going to join us. A dietitian and a pulmonologist will answer all your questions and queries. Join us with your family and friends. First 200 participants to register are going to get an exciting gift from Apollo 247. Register and we shall see you there. Hello everyone. We all know that nutrition plays a key role in keeping us healthy, and the upcoming National Nutrition Week is the perfect occasion for all of us to learn how good nutrition can equip us with strength and immunity to fight COVID-19. This Sunday, that is 30th August at 11 a.m., join us on Apollo 24/7's Health Hour, where two senior doctors from Apollo Hospital are going to join us. A dietitian and a pulmonologist will answer all your questions and queries. Join us with your family and friends. First 200 participants to register are going to get an exciting gift from Apollo 247. Register and we shall see you there. Hello everyone. We all know that nutrition plays a key role in keeping us healthy, and the upcoming National Nutrition Week is the perfect occasion for all of us to learn how good nutrition can equip us with strength and immunity to fight COVID-19. This Sunday, that is 30th August at 11 a.m., join us on Apollo 24/7's Health Hour, where two senior doctors from Apollo Hospital are going to join us. A dietitian and a pulmonologist will answer all your questions and queries. Join us with your family and friends. First 200 participants to register are going to get an exciting gift from Apollo 247. Register and we shall see you there.
Between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaste, namaskar, vanakkam, sat sri akal, and welcome to Apollo 24/7's Health Hour. Pandemic, COVID-19 has restricted us. Our moments, our work, our relations, everything is restricted. And our priority right now is our health, good food, health, and taking care of ourselves. So here we are bringing you India's largest healthcare network right into your palm. This is Apollo 24/7, where you can connect, consult doctors, buy and order medicines, and keep all your medical records at one place. And today we are bringing you a very, very interesting discussion on nutrition and the role of nutrition in fighting COVID. We're going to invite 2 expert doctors where you can chat with them. You can ask all your questions. I shall take up the live questions. You can type in the chat box. I'll take up the questions with the experts today. And also there is a health quiz where I'll ask questions. You can participate in the health quiz, win exciting prizes from Apollo 24/7. And let's start today's show. Nutrition Week. So this is the time that we all concentrate on nutrition. We have the expert dietitian today, Dr. Anita Jatana, who's going to join us, who's the chief dietitian at Indraprastha Apollo Hospital, Delhi. And she'd been the convener at Delhi chapter of Indian Dietetic Association, over 35 years of experience in the field of nutrition with special interest in critical care. She's awarded a Scroll of Honor of Personal Achievement in Lady Irwin College, awarded for outstanding contribution to the field of dietetics, and presented more than 50 scientific papers at different national platforms. Ma'am, it's a pleasure and welcome to the show, Dr. Anita Jatana.
Namaste and
Namaste,
good morning
ma'am,
to
and
all.
welcome, ma'am.
And thank you for this opportunity. It's great because we are doing it in the nutrition forthcoming month, not week, as you said, Jhansi. So it's going to be nice to connect to so many people at large, instead of just one-to-one, which we manage. So thank you for this big opportunity. And I think we'll really, really benefit connecting with everybody at large.
Great, ma'am. Ma'am, and I also have another doctor who's going to join us. Let me invite our expert pulmonologist for today, and Dr. Vijay Kumar Chetty, who is an MD Pulmonology, IDCC of Critical Care, FSN Sleep Medicine, FCCP, pulmonologist at Apollo Hospitals, Jubilee Hills, Hyderabad. He specializes in pulmonology and sleep disorders, over 15 years of experience in pulmonology. He's the HOD of Pulmonology, Interventions and Sleep Medicine, American Oncology Institute, Hyderabad. He's a tutor of critical care and pulmonary medicine at a prestigious CMC Vellore, that is in 2008. And the most above all is the passion that he has for educating and increasing awareness about challenges currently being faced in maintaining the respiratory health. Namaste, Dr. Vijay Kumar Chetty garu. Welcome to the show.
Namaste, Jhansi garu. Namaste, Anita ma'am.
Namaste all.
Very good morning. Happy morning to you all.
Gee. So this is a very interesting and important discussion is what I'm thinking. as we all battling, we are taking care of external and health management. While we talk about the nutrition week, it becomes important to focus our direction into nutrition. Ma'am, let me start with you. How important is nutrition to maintain good immunity?
Jhansi, it's important at all times. But today, when we are battling with COVID-19, it's all the more important. And I'll take you back to what Mahatma Gandhi, father of a nation, once said. It's health that is real wealth and not pieces of gold and silver. So we've all been really overworked. We don't look after ourselves. And that's the time when our immunity goes down. So we really need to eat in a very focused way. And there is no one bullet which says, okay, just do this and you'll be fine. It has to be a holistic approach and a lifetime commitment. It's like, do I start at 40? No, it starts right from childhood. In fact, it starts from conception. So it's a lifetime approach.
जी. So एक दिन में अगर मुझे करना है तो सप्लीमेंट्स लेके या विटामिन्स, न्यूट्रिएंट्स, एवरीथिंग बना के एक बड़ा कैप्सूल तो नहीं ले सकती हूँ. ये तो समझ में आ गया. तो ये तो इन्वेस्ट करना पड़ेगा मुझे गुड हेल्थ में, गुड न्यूट्रिशन में.
Yes, it is.
As we are, we have. It's not just the nutrition week, as I heard. We are celebrating a nutrition month. And why is this so? And why is this suddenly become so important?
So health is not from the outside. It's what we really eat, which has a big focus on what we actually have at later years. So eat throughout your lifestyle, through your lifetime, and you'll find that your immunity is so strong. Make sure that you include food from all the food groups. Okay. We keep on going to our Dr. Google. Somebody will do ketogenic diet. Somebody will do, I'm no carb diet. I'm a no gluten diet. All those fashionable things that, we keep hearing about. But believe me, every part of the food is important. So make sure you've taken all the food groups, your dals, your cereals, your fruits and vegetables, your milk and milk products. So that will ensure, you get all your macronutrients, which is fats, proteins, and carbohydrates, and all your minerals and vitamins. So it's a very fine balancing act between what you eat and then also taking a holistic view and, doing a little exercise, sleeping on time. So it has to be a complete platter which goes together. Can't identify one from the other.
I totally agree. And I hope Dr. Vijay Garu also agrees that it's not just one and it's...
yes, I do agree with completely Dr. Anita. So my four principles is, okay, sleep well, eat well, exercise well, relax well. This is a very important. Become a seer. Seer means Rishi. Okay, right. SEER. Sleep well, eat well, exercise well, relax well. If you have this all four things together, you will be a champ in terms of your immunity.
Perfectly said. Dr. Anita, there's this misconception and so much of wrong advice going on in the WhatsApp groups or, social media, digital media, कि ये खाओ, ये मत खाओ, ये खाने से आपकी immunity बढ़ जाती है, ये पीने से आपकी immunity हो जाती है, नहीं तो ये मत खाओ, ये इससे COVID आती है. There's so much of false information going. So let's break it down into, आपने बोला है कि simple balanced nutrition रहना चाहिए. तो non-veg खाएं या ना खाएं? Fruits में थोड़े fruits खाएं या ना खाएं? How do you put this?
Yeah, Jhansi, I'd really like to say that, as I said, everything is important. You need your carbohydrates for your calorie goals. So people who are giving up their cereals is not a good thing to do. In India, what we find that, 90% of us are on a very low protein diet. What we do, we just tend to have a lot of carbs, most of us. It's a upma poha breakfast or a roti sabji or a toast with jam. And that's what we take for lunch, roti sabji. We don't carry our proteins, we don't carry our dal, we don't carry curd because it's spill proof nahi hai. To kaise leke jayenge? Wo gir jayega.
Convenience matters most.
Yeah, how to carry it? Nahi, wo garmi hai, dahi khatta ho jayega. And then when we come home, we probably have a katori of dal, and that also sometimes, you do vegetables. So we're finding that a huge problem. Proteins play a very, very important part in the immunity building. But having said that, you have to include your fruits and vegetables. So carry a couple of fruits with you to office. Make sure they're washed well. Don't take them cut. We are in the humidity season. So you also have to play safe. Lots of vegetables during the day. Don't forget the water. Very important for hydration. So at least 2.5 liters of fluids. You can take charge, lassis, but don't take sweetened drinks. Sugar is definitely bad for the immunity. Sugar, trans fats, fried foods, definitely avoid. Maintain a good weight. Underweight, undernutrition, or obesity and overnutrition, both are bad for the immunity. And we see both in India. So both can really harm the immunity. It has to be both things which are well maintained, maintain your weights well. And as Dr. Vijay just said, sleep well, be happy. And you've seen 12 o'clock, you're getting WhatsApp messages and you wonder when people sleep. You have to sleep by 11. That is important. And people who don't sleep well, it will bring down the immunity. Little happiness, anything that gives you happiness, music, dance, meditation, do that, do a holistic way, and you'll find that you can fight COVID, of course, with all the other precautions of maintaining distance and hand hygiene, you'll be able to be safe.
Yes, ma'am. And quickly, ma'am, balancing nutrition. See, I know that women head the kitchen, most of the homes, but we're also working. So as a working mother or as a person who's handling the kitchen, no gender there, but as a person who's handling the kitchen, we are all in this one paranoia. Ki ye sahi kar rahi hu, ya na kar rahi hu. How do you suggest and how are you balancing your time and life?
It's been difficult, definitely. But as I tell all my patients, make sure that you've included proteins for your breakfast. As I said, we make a lot of mistake on only doing a simple thing. We started going more and more towards simple foods, packaged foods. Just get back, making something like a chila or a paneer toast or an egg or boiling an egg or just doing a sprouts. And then making sure that you've taken whole grains. We need all our vitamin A, C, D, and we need zinc, we need selenium. All these are the antioxidants which are very important today. Vitamin D, which is free, sunshine. That's all we need, 15 to 20 minutes of sunbathing. And we go buying sachets. So once we do it, as I said, in a holistic way, we'll be able to ensure we get these very important antioxidants. Vitamin C from your amla and fruits, and your vitamin D from your sunshine, vitamin E from your nuts and seeds. So include all those almonds and those chia seeds back into your things. Include millets, which are good in fibers. So that's the way to do it. And make sure that you do whole dals for lunch. Kala chana, white chana, rajma. India has so many dals. Just make them by rotation, and that's what you carry for everybody, including the children. So it happens in such an easy way. Carry a lassi, a flask, that's it. And come home and make sure it's a balanced meal, because that's one family time we sit and eat together. So include all the food groups, as I'm mentioning to you, on your dinner plate.
Exactly. And I understand the sense कि खरीदो मत, आप जो खरीद रहे हो वो ill health तुम खरीद रहे हो, तो बनाओ और खुश रहो. That's wonderful, ma'am. Thank you. And let me connect to Dr. Vijay Garu here. Vijay Garu, how are you keeping your good health? I see that the COVID frontline warriors have to face COVID every day in and out. You people must be facing it. But how are you taking care of your health?
See, my principle in my daily routine is, however, definitely we are all handling with, too much stress. Seeing COVID patients probably, 60 to 70 a day is not at all a good job. It's a very difficult job.
Very difficult.
So, and very stressful, because sometimes you have to interact with them over telephone, or sometimes you have to interact with them with, direct, physical contact with, all PPEs. When we are having these PPEs, it's really tough to, keep our stamina, keep our, energies focused for a longer duration. Maybe half an hour is good enough, but beyond, 2 hours, it's very difficult. So what I do is, I'm not a gym guy. Let me tell you frankly. Yes, I don't love to be in gym. Yes, maybe, some workouts I do, weekly, but I love to trek a lot. Trekkings.
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 Then your cardio is completely on.
Yes. Trekkings, being into nature. We all forget to be with nature. We are no longer, spending. It's a more of, modern world, mechanical world kind of thing. I love to be in nature. Okay, whenever I get opportunity, I just go to drive to Sri Salem. I just go to some forest area, and then
And you
I
fill
love
your
to
lungs with good air and come back.
exactly,
Yes.
exactly. And second important thing, as I was mentioning, sleep well. Okay, you have to, whatever the stressful situation is, you have to make sure that okay, you have to at least 6 to 8 hours sleep daily and relax well. Okay, it's different. It's very unique. Everybody responds to music differently. Okay, everyone has to select for themselves what music is soothing for them. What music is really energizing them.
Yes.
Sometimes Western music. Sometimes it is okay. I'm a huge fan of two important composers. One is Bismillah Khan Shenak. That's a wonderful. Okay, if I play this for 10 minutes in a day, okay, next 24 hours, there is no charging that is required for me.
Right.
I can work without any relaxation in
So
between.
different
10 minutes of
mechanisms
music.
for different people will work.
Exactly.
For example, I have my books all the time and I'm reading all the time. So that's wonderful, Doctor. SEER is something that we also look forward, and we will also implement certain factors. So now the COVID situation has gripped us in fear. And the most vulnerable group, I suppose, are the COPD and the asthmatic group. You must
Right.
be seeing them all the time. And what are the suggestions that you have for them? Any specific routine?
See, there is a huge myth that is going on the social community, the social media, that okay, whenever they are taking these COPDs and asthmas, we manage them with inhalers. Okay, so whenever they are on inhalers, most of these inhalers contains tiny amount of micrograms of steroids that is really required for to keeping them hale and healthy. So to breathe them better. Okay, so this amount of steroid is essential for these COPD patients and asthmatics. So please don't buy myths that is circulating in social media that these steroids can aggravate or make them susceptible to COVID. This is a big wrong. This is a big no. Okay. So please stick on to your inhaler medication. That is very important. Apart from our SMS, that is social distancing, mask, and sanitizer. These are the very important key principles, basic principles to keep them hale and healthy. Exercise a lot. Okay. At least make sure 40 minutes in a day. Okay, you are at least brisk walking. That is very important.
Right. And the largest killer in COVID and across the globe with other reasons is smoking. And I understand that you are a person that you are looking forward for respiratory wellness, and you advocate respiratory wellness really hard. So
Yes.
what are your inputs on smoking cessation?
Yeah, smoking, that is really my passion, to make my patients, my clients, to make them get rid of this habit of smoking. Most important thing is a doctor's suggestion. Many of doctors, they just write just prescription, say that not smoking. That is not sufficient enough. If you add your additional 5 to 10 minutes of your time to in counseling these patients, to make them understand what are the benefits, make them understand how the healthy relation can be enhanced within the family. Because as a family, if you are healthy, then we can make our nation healthier. So that is what is my principle. I am really committed to see a smoke-free world. And second important thing is, after a proper counseling from the physician, second important thing is commitment in the patient's mind. It is very, very important. He must take a decision that I have to quit smoking. So if he doesn't take that decision, whatever you do, whatever medicine we add, it is an incomplete. So it is very, very important that physician should tune to make a rapport with client's mind, and then get in process that we have to almost feel like we are one with them, and then make them understand the importance of stopping smoke.
Yes, and I'm proud to say that my father, as you said, he just with his will and determination, 10 years back, he stopped smoking. Just
Fantastic.
like that. One fine day, for almost good 30 years, he was a chain smoker and he quit smoking. Of course, he's dealing with COPD.
Right. In fact, the one of the best method in the world that is proven method is going cold turkey. Okay, just decide, fix a date, and then stop quit smoking. That works wonders in many individuals.
It did. It did.
And it did happen in your father's case.
Yes. With this, I think we should get into the question session. The live chat is buzzing. Let me first look up for the questions. All right, ma'am, how many days do we need to take vitamin C, zinc, vitamin E, etc.? Any questions that people can have, can they type in their query in the chat box? I can select the questions and I'll ask the questions to doctors. Ma'am, the first question is, Mr. Rangareddy is asking this. कि कितने दिन मुझे vitamin A, C लेना है?
खाना है. We loaded with vitamin C, please, and don't take your supplements without doctor's advice. Don't just put in medicines. Yeah, there are certain vitamins which can cause hypervitaminosis. Okay, especially vitamin D, A, the fat-soluble vitamins A, D, E, and K. Okay, so don't do this supplementation on your own. We've loaded with amlas, oranges, mosmi is there. Lemon is there, but just a word of precaution with vitamin C. It's very heat viable. So when you consume it, don't heat that vitamin and consume it immediately, because even exposing it to air is not going to make it so absorbable. Okay,
so
just fresh. The moment you cut your fruits, just consume them. So amlas, oranges, full of them.
All berries.
Osmies now coming out in season, and all the green peppers. So just add them to your diet. And amla and guava is the highest on the list. So include them every day.
Yes, ma'am. And also the nuts for the zinc and other selenium.
Yeah. So the one, you get your zinc from your non-vegetarian eggs, nuts, whole grains again, and from your dals and pulses. So the moment you've done dals and pulses, you're getting your zinc. And your vitamin D, I told you, is a free vitamin. And iron is important again. Vitamin E again from your nuts and seeds. So the moment you've included them into your diet, you actually don't need supplements unless you're recovering from an illness. Then under medical supervision for a short period of time, and then go back to your eating a well-balanced diet, and you'll be able to get them all easily through your food plate.
Right, ma'am. Dr. Vijay, here's a question. Shweta is asking it, lost smell due to COVID, and when will I get my smell back?
See, when compared to, this is the least bothering symptom that I feel as a physician. Okay, when people are fighting with their life, fighting for their lives. Okay, losing taste and losing smell. Okay, generally with the multivitamin supplementation, it should come back in 2 to 3 weeks time.
Right.
But they should not worry about this particular symptom.
Right. यहाँ पर रघुबीर सिंह पूछ रहे हैं कि after COVID-19 I have breathing problem. What is the solution?
Yes. Right. This is yes, I cannot give you entire solution here in next 2 minutes, but I can just brief you as much as possible. Say during acute event of COVID, probably patient may be landing in ARDS. Okay, acute respiratory distress syndrome or adult respiratory distress syndrome, which can make them feel, their oxygen levels go down and then, feeling breathlessness. But when they are recovering, so there are multiple things that can happen. One is organizing pneumonia, and second important thing is COVID pulmonary fibrosis, which are two important problems that we are encountering in these COVID patients. They must be really, really watchful. Any saturation less than 95. Okay, please make sure you visit, your physician or pulmonologist and get it evaluated. Second important thing, if your saturation is well above 95 and you are walking for 6 minutes, what we call it a 6-minute walk test. If you walk for 6 minutes and then your saturations are dipping to less than 95 or more than 3 or 4%. Imagine before walking 98 and after walking the oxygen levels are going less than 95. That means the problem is not yet solved. You have to be really, this is a red flag, and you must see your pulmonologist as early as possible.
Right. Walking at what speed, doctor?
Normal walking is good enough.
Normal. It's
6
not
minutes.
Like 6 minutes.
It's not a brisk walk. It's not a brisk walk.
So this comes from a personal question. Right now, I'm dealing with a COPD who's 79-year-old. My father, who's asymptomatic as of now, but he is tested positive. So his being COPD, his generally oxygen saturations are generally low. So how do I understand these levels now?
Yes. Besides, just oxygen, depending on just oxygen levels, okay, we should look for other vital parameters like, running temperatures. If a client is running, more than 101 temperature without, yes, we are using probably Dolo or paracetamol. Despite that, for few hours only, the temperature is being reduced and it is bouncing back to again 101. And then how is his overall mental status? And how is his, whether he is active, whether he is taking his food properly or not. All these parameters comes into play. Another important parameter that one can monitor at home is checking the respiratory rate. Okay, keep palm on the chest of the individual and then measure for 1 minute, complete 1 minute. If the respiratory rate is more than 24, be cautious. That's a red flag sign. More than 24 breathing per minute is a red flag.
All right. So 6 minutes walk, whatever your oxygen saturations generally are, if they're falling, then that's a red flag. And respiratory break 24 is a red flag. Under 24 is a red flag.
Good.
All right, doctor. So next question is, Aarti does, I think we've answered this question, loss of smell and taste, please help. I think doctor already has answered. What are the chances that one will get infected with COVID?
Right.
Anita,
chances of getting,
yeah.
right, please, Anita.
Yeah,
Please.
They have to take all the precautions, but building up your immunity is very important. So if you have a good immunity, you've seen there are some who are born with a very good immunity, they don't fall sick, and there's some who keep on falling sick. So you can build up your immunity by eating good, making sure that you've got all the micronutrients that we are talking about, the vitamin A, the E, the zinc, the selenium, and we need our proteins on the first prime importance. So the moment we've included them, your immunity is strong, and walking, as you said, is a good immunity builder. So it's a mood enhancer also, but also builds up your immunity. And if you think going out is not safe, you have to make sure that you're wearing your masks when you go out. Otherwise, some form of physical activity at home is very important to build up your immunity so that you don't get reinfected, even if you're recovering. So over to you, Dr. Vijay.
Yeah.
Doctor,
next question. Yeah. Would you want to answer that, or should I continue with the next
question?
See,
currently in this pandemic, the entire globe is hibernating. Okay. This hibernation is because of, just we have to conserve, and coronavirus is, teaching us many, many new things. Okay. For example, teleconsultation services, which we were initially, 6 months back, we were initially, very hesitant to do teleconsultation service. Of course, Apollo was the first one, to launch teleconsultation services. Way back in, to my knowledge, the first teleconsultation I have done is in 2008. Okay, almost 12 years back. So now, with the availability of teleconsultation services, yes, we should minimize. Yes, we are helping our planet Earth in many ways. Okay, the commute time is decreased, and then unnecessary traveling, unnecessary fuel. Okay. Gasoline usage, and then we are reducing pollution as well. So we should see this in a really, a new way of life, and then really use our teleconsult services so that it will be for all minor ailments. We can, really use teleconsultation services, and then and second important,
Apollo 247. Where you can book your online consultations. I suppose both of you must be using this app. And
Jhansi, I must tell you that it's been a great experience, because I've actually been counseling people from all over India. So it's lovely, being able to connect to people in Guwahati, and we've had Kolkata, we've had Hyderabad, Delhi, of course, is there. But so you're able to touch base to people even in smaller towns. I had people from Aligarh, who would probably not be able to go out. So it's been a lovely experience. You've been able to actually solve people's problems, and they're doing better. People who had lost weight, gained weight, and who had low immunity did better. So it's been a lovely experience reaching out to people from the safety of their houses and from your hospital.
I just want to add one important, my experience in teleconsult services. One of doctor, probably, around 75, 80 years age, he consulted me through this app from Kashmir.
Wow.
Okay,
Yeah.
Kashmir. Okay, and he was totally amazed. Doctor Saab, I am, going around the hospitals, and then, and I never got that kind of this much response, okay, which you have provided over, just 15 minutes interaction. And he makes sure, even if he is doing well now, what is he doing is every 15 days, he consults me and then says that, he is doing well.
Wonderful.
So this is really wonderful.
So there's a patient and the
Yeah.
doctor rapport building as well.
Yeah,
There's
Building
a
up.
patient. Lovely.
So you're able to monitor them much better, Jhansi. Yeah.
Ji, Anita ma'am, I'm sorry, I missed
I said you are able to really monitor them much better
Yes.
because no commute is there.
True, and I request if people haven't downloaded Apollo 247, it is the time that you have this app in the hand. It is powerful tool that I've experienced myself. Yeah, I order my medicines also here. Huh? It's so convenient. Yeah, right. Anurag Pagdala is asking this question. How effective is antigen testing? One of my friend's father lost his life because 2 times it was false negative, but after 25 days, he fought with corona and passed away. That is the first question.
See,
Yeah.
any test that is there, okay, in the market will have, false, positives, false negatives as well. Similarly, okay, COVID testing has got antigens and RT-PCR, PCR analysis. Okay, this PCR analysis will have, can diagnose in only 70% of cases. That's the test limit. Okay, the limitation of the test. We cannot do anything. Sometimes we do repeat, twice or thrice as well. But it's a rarity. But again, it's quite unfortunate. I feel sorry for his loss.
Yeah, yeah. Anita ji, ये question है युवराज स्वामीनाथन से. I am CKD patient and the situation salt-free diet is necessary. Please guide.
No, salt-free diet, it's not there, but yes, definitely low sodium. And for CKD patients, we have to monitor a lot of things. It starts with proteins, fluids, sodium, potassium, phosphorate. So it is a little difficult diet. And if they are diabetic with it, then you have to also monitor the amount of sugars they are taking. So it's a difficult thing that I can't explain over this in a couple of minutes. But and please do not make it protein free. That's the problem that most of the time we see. The moment anybody says you are a CKD, they on their own restrict proteins totally. And by the time they come to us, they're totally malnourished because they've eliminated all proteins from the diet and probably only living on ghee. I don't know who guides them, but it's ghee and tinda. That's all that they're living on. So your proteins are required. It depends on your weight and your GFR. So that fine calculation we do and then divide it into the meals so that you are not overloading your kidneys, but you're not malnourished at the same time. So we can definitely chart out a plan for you if you give me all your reports and we'll help you with it, surely.
Ji, the next question is from S. Babji Balchandar Rao. I'm Babji, 44-year-old. I'm positive. Then 7 days got negative. After I came house, what precautions at home? What medicine taken? How long home quarantine? Okay. Basically, he's a 44-year-old.
I got it.
Yeah, you got it.
Right,
Doctor?
right. Yeah, I got it. Right. See, basically, this will be very useful question for lakhs of families. Okay. See, at what point of time our national guidelines declare that he is not contagious. That is what is important as per ICMR guidelines, current ICMR guidelines. Okay, 17 days from the day of symptoms. Okay, imagine August. No, day of symptoms. Okay, starting day of symptoms. That means August 1st, someone turns positive. Okay, August 18th onwards, he can declare himself that there is no need to retest again. No need to retest that he is negative, and then he can declare himself as he is non-contagious to others.
Right. So he is non-contagious. Yes.
Yes. Within this 17 days. Okay. If he is home quarantine, make sure that he is using his own room. He is limiting himself to the room, and then he uses, a restroom separately so that, no one else goes to and attend the restrooms. So that's important. And all through the 17 days, very, very important, very crucial is, okay, check his saturations, oxygen levels. As discussed before, please, walk and check your saturations, whether they are perfect or not. If they are perfect, oxygen saturation is perfect, no need to worry. Just, consult on online, then everything will be fine. If the oxygen saturations are dipping down, then that's a red flag. Please do not miss this warning sign and consult your doctor as early as possible.
All right.
I'd like to add something here, Jhansi. They must take care of their diet, which is very important at this recovery phase. And they've already said that they have problem with their tastes and they're not able to eat well. So if they have problem in consuming the normal diet plan for them, they should consult somebody, and then maybe we'll guide them with supplements. And they can also use a lot of herbs and things which is there in our kitchens. A little pinch of haldi, ginger, cloves, but please do not take it in excess. When we are talking turmeric, it has to be a pinch of haldi with milk, and do not take in excess. I must share with you, we had an incident where people were doing excess of cinnamon and cloves and ginger and too much of turmeric. So we've heard that it is causing problems with the liver. So that also has to be done under supervision. Don't do excess. Excess of anything is harmful. So the good things can become bad if done in excess. So it's a little balancing act here again.
Yes, doctor. Dr. Vijay, but in continuation with what you were saying, there's a question, and I think it's a very relevant question. If a person who is in isolation center with good medication, after 1 week he gets negative, if he touches his clothes, or if we touch his clothes or things, will he be affected again? I think
no.
Let me get the sense. While staying in isolation center after a week, if he gets good medication and if the person is tested negative, if he touches his clothes or things, will he be infected again?
Okay. See, the chances of reinfections are very, very rare, but we have seen good number of cases where reinfections do occur. But all reinfections occur, they don't occur in this, 3 week, 4 week period. Probably if the patient's initial symptoms are very mild, so what we call it is mild disease, moderate disease and severe disease. If the mild symptoms is there, then probably they have, some fever for 1 day and then some, sore throat, and then next day onwards they are fine. These kind of patients, what will happen is their immunity is also less. So the antibody levels, when we monitor them 6 weeks later, their immunity is very less. So those who have moderate and severe disease, that means those who felt some breathlessness and then oxygen levels dip down somewhat, these kind of patients, they do develop a lot of good immunity. Antibody titers are pretty high. So if at all reinfection occurs, the chances of reinfection in mild cases is pretty higher. Moderate cases and severe cases may not get reinfection. Having said this, they should not, they must follow after declaring cure as well. Okay, the social distancing, mask and sanitizing are very, very important.
Right. All right. The next question I wanted to take was, my mom is COVID positive. Can she have protein such as keema daily or only twice or thrice a week? She lacks energy. She's low on energy. Jayashri Kilaru is asking this question.
Yeah, Jhansi, as I said, first the carbohydrate needs should be there. The calories should be well balanced through the day, and proteins are very important. Instead of doing keema the whole day, which we definitely say goes slow on red meats, you can do definitely chicken and fish, and you can do a lot of dals, you can do nuts and seeds, you can do milk and milk products, which would also give her a calcium at the same time. So these are your other protein sources which you can include. So it cannot, just don't do keema every day. There are lots of other proteins that you can do. Eggs is a very good thing to do. So please continue giving her at least an egg a day. That's one thing which is very doable and easy. So do that.
Yes. And also the vitamin consumption has come up so much that everybody is walking to pharmacies and buying vitamins. There's a question, supplementation high supplementation is linked to cancer and tumor growth. So can you please give us some information on if supplementation is important or not?
Supplementation is very important when you are recovering from an illness, and that's what we do in hospital every day. But if you're normal, then just as I said, eat normal diet. And the moment we've included proteins from our protein sources, which I just mentioned, and you've had your carbohydrates, you've had your fruits and vegetables, 4 to 5 servings, and it'll just, and of course, use healthy oils. Go slow on trans fats. There's nothing like supplementation will help the cancer cells to grow. What worsens the cancer cell is obesity. There's a lot of research that says that if you're obese, you're more prone to it. Going slow on fiber, you're more prone to rectal cancers. And definitely, processed meats are bad. The charred meat is bad. Using trans fats is bad. Using fried foods is bad. The oil that we use for frying, and then again, you're using the same oil for refrying. What is happening outside when you're doing samosas and kachoris, that becomes more harmful. So, and the red meats are more harmful. Processed meats, definitely. The charred meat, what you have when you have roasted chicken, those cause more problems of carcinogen. And definitely go slow on sugars and sugary drinks. That we definitely want you to avoid. So no trans fats, no to sugar and sugary drinks, and a wholesome, healthy diet.
Done. And that's what I've been following all these years. So
Great.
Let's hope everybody takes a great message from this. Dr. Vijay, this question is for you. Mr. Shafi MD is asking, please inform the COVID effect or severity on the first trimester pregnant women and children below 2-year-old.
Yes, it's a very broad question, but having said this, children generally have, very good immunity. Okay, COVID is not generally not affecting severely to kids. That's one important thing. Having said this, severe cases have been reported, but it is not, as common. Before less than 2 years, the data is very less. We have in India a neonate turned positive, okay, with COVID, but also it is there. Okay, newborn, okay, turned COVID positive is also the data is there. But I'm not the right person to comment on, how pediatrician would be, right person to comment on this. And the first trimester, definitely it is, they're going to, rule of thumb is, okay, in pregnancy, if we see viral infections in lung, okay, particularly H1N1, swine flu, okay, will affect very badly to pregnant women. But here, COVID is not affecting severely to pregnant women to a larger extent. Yes, we have dealt with, very severe cases in pregnant women, and we have recently, I'm proud to announce that we have a 9-month gestation lady came in severe COVID, and we as a teamwork, we did delivery while she was on ventilator, and she recovered 10 days later. Okay, this is a fantastic, achievement from Apollo Jubilee Hills, Hyderabad. Wonderful. And yes, so, but generally speaking, for common man, okay, for first trimester, please be careful if the vitals are really compromising. And I must also tell you, if she need to use antivirals, please use it under, pulmonologist or, infectious disease specialist consultation only. And if at all, if they use, probably if the antivirals are not proven safe for the fetus, they may need to, really, look for, other options.
Done. Thank you, sir. Suresh Pega is asking this question. Mild infection in lungs, CORAD is 6. How long it will take the infection to be fully clear in lungs?
It varies from individual to individual, Jhansi Garu. Okay, again, okay, we have seen, mild infections that just, within 1 week time, they all become fine. But severe infections, they last for even few months. But one important message I want to give here is, first 10 days, the viral will be alive in the body. Okay, virus can spread in first 10 days aggressively. But beyond 10 days, the chance of virus actively spreading to others is very, very less.
Right. All right. Anita ji, what kind of a food a patient with fatty liver grade 1 should avoid?
Alcohol.
Yeah.
Well, but having said that, the most important thing, The most important thing is to maintain weight. And let me share with you, Jhansi, we are seeing young children with fatty liver when they are overweight. So monitoring them right from young age, don't make the children go this side of obesity. We are seeing huge problems which we never saw earlier, the non-alcoholic. So it's not alcoholic, we're also seeing it in the non-alcoholic patients. So reducing weight is important, avoiding trans fats, too much of sugar and salt, and red meats is very important. Including a lot of fruits and vegetables, whole grains is the way forward, and maintaining a good ideal body weight. So a simple thing, minus your centimeters height, 100, you know where your ideal body weight is. So I've shared the secret with everybody.
Right. Dr. Vijay Sudhakar Iyenk is asking this question. How important is it to wear a mask, especially the N95 mask, while traveling out?
This is very crucial information, Jhansi Garu. Okay. See, particularly with the all domestic and now we are going to even international air travel get start soon. Okay, it is very crucial. Okay, to wear a N95 mask, particularly in flights and then public transports, very important. But if you are traveling in a non-public transport, there is no need to wear any N95 mask. Simple surgical mask is good enough. If you have a co-passenger, if you don't have, there is no need to wear any mask. But in regular atmosphere or office atmosphere kind of thing, you may need to use surgical mask. That is pretty good enough. Unless it is overcrowded place, then probably N95 is definitely indicated. Otherwise, I believe surgical masks do pretty good job.
I think Srijita Pal, this question, what the answer Dr. Garu has given has answered your question. Give me guidelines to travel by train and the steps to follow after. I suppose that generally train also.
No, all public transports, just if we can avoid, that is the best thing. Prevention is always better than cure, always. Okay, let's not, because community spread is very high right now. Okay, the community transmission between among the asymptomatic carriers. I would like to share. Okay, if you see, if you have 30 cases posted for surgery, we will do routine screening. Okay, at least 3-4 numbers are turning positive without any symptoms. That means there is a huge amount of community transmission is there. Okay, community spread is there. So in this crucial hour, probably next couple of months, if we can avoid public transport, that is the best way of going. If you cannot avoid it, make sure that you don't take off your mask, particularly in public transport.
And don't touch any of your nose and eyes, mouth.
Yes.
Yeah. And keep sanitizing your hands the whole time. That's very important, because you know what you've touched at what level. So when you're going out, even when you're touching the railings, you have to sanitize your hands. We don't want you to fall also, Dr. Vijay.
Right.
Your ladies are wearing heels, so we don't want you to fall. So then they can use that. And in the lift, there's a very nice thing where you should face the wall of the lift and not the inside of the lift. So, you are keeping away. So that's social distancing in the closed atmosphere.
Right. And also, I think Apollo 247 has come up with this cough scanner, where you can cough if people are worried, they are susceptible to the virus, they can just cough into the cough scanner for 10 seconds and check their risk level. And there's a wonderfully managed artificial intelligence case that can give you results and tell you how risky it is for you and if you need to go for a test. I found it really useful, and it's there on Apollo 24/7.
Yes.
Next question, Anita ji, aapke liye hai. After recovery of COVID, from COVID, what are the foods that need to be taken?
Jhansi, it has to be a very well-balanced diet plan. It has to be a holistic approach. You have to manage for the whole day with a good diet intake. It can't be at one particular time. So make sure that you've included, as I said, all the food groups which is important. You've taken your milk products, you've taken your proteins for your breakfast, you included whole dals, you included whole cereals, you included good fats, which are also important, and you included a lot of vitamin C rich foods, which is guava. It's now available across everywhere, and vitamin C lemon, and you've got your oranges. So vitamin C plays a very important role. You've got your walnuts. So take a handful of nuts and a couple of tablespoons of seeds. That will ensure that you get all your antioxidants also happening, and that will build your immunity, and you'll be able to sort of get back to your feet much faster.
Right. Thank you so much, ma'am. And Dr.
Just
Vijay,
to add, Dr. Jhansi here,
Yes.
okay, apart from nutrition, they have to exercise. Okay, exercise should not be, but particularly when they have moderate to severe disease. Do not jump and start strenuous exercise. That is not at all indicated while they are recovering from pneumonia. Okay, because it's going to hamper or it delay the process of healing naturally. So just do mild exercises, something like walking. Okay, not too much heavy weightlifting kind of thing. Okay, and another very important thing is there is a practice that pranayama. Okay, pranayama like anulom vilom. Okay, which is recommended. Yes. Okay, all these patients, any patient with suffering from COVID or non-COVID can be do it, but this aggressive pranayama measures like
Kapalbhati,
Bhastrika, Kapalabhati and Bhastrika or Brahmari pranayam. Okay, it should not be encouraged in these patients because it is going to delay the process of natural healing in their lungs.
Yeah. There are two important questions. One from my end, in continuation with your answer, and also Aruna is asking a slightly similar question. Aruna Prabhu, we are having asymptomatic COVID patients in our apartment. We have moved out into our daughter's house, but how safe is it to go back to our house and use the lift? That is one. And my question from my own home, where I'm the caregiver for a COVID patient at home. So what do I need to do? Can I let the person walk? As you're saying that the patient needs to walk and exercise. So how do I manage at home, and how can Aruna Prabhu's answer question as well?
So with this, all digital watches and all those things, okay, we can, count our footsteps. They can walk for somewhere around 5,000, 7,000 steps in a day. Within the room itself is good enough. They need not come into, our, common living area and then walk. They can do it at the home itself. And then the second important thing is when they are coming into contact with, common areas like lift areas. Okay. Yes. The virus, if it is there in the air, it will be dropped down to the floor and in less than 20 minutes. So if someone walks away in a common area or lift, okay, next 20 minutes is the risky zone. Next 20 minutes, the virus will be in the air. So that 20 minutes, what certain apartments, what they are doing is, example, if yes, we have reached a place, time there where we were discussing about, in Singapore there were so many cases, in Mumbai there were so many cases. Now it is there it's in our own home, there are, COVID patients. So in this crucial time, if 20 minutes can be allowed in the lift, okay, after the person or patient walks away in the lift, next 20 minutes do not use this lift. Or if you want to use it with an N95 mask and then sanitize yourself once you reach your home. That's what is, I feel that's the best thing.
And Jhansi, they should use the back of the hand when they are, touching the knobs or the light plugs at home. So, they are not exposing themselves or the others to it. So always use the back of your hands and use this when you're coughing and sneezing so that your hands are clean. Doing that also really goes a long way.
Yes, definitely. And sanitizer at public places like apartment complexes.
Yeah, at every place.
Have sanitizer ready before and after. That is one thing that we can also think. And my question, Dr. Garu, I'm the caregiver at home.
Yes.
So what is the risk that I'm carrying, and how do I protect the patients at home?
Before that, build up your immunity.
Yes.
You will get it. Yeah, over to you.
With a serious interest in nutrition and well-being, I think I am taking care. But other than that, any general practices?
No. First important thing is stop worrying, stop panicking.
Right.
Because every home is, having no pulse oximeter, or at least every apartment complex is having, pulse oximeter. If you want to use, if you don't have one, please buy one. Or if you don't have one, don't hesitate to use the others. And then once you use the others pulse oximeter, immediately wash your hands. You can sterilize yourself. That's very important. So long your vitals are stable. Vitals means Oxygen levels more than 95, respiratory rate less than 24. If yes, most of our apartments will also have a BP measuring equipment. If the BP measuring equipment shows your BP is well within normal limits, or otherwise the red flag is if the systolic blood pressure is less than 90, then it's a dangerous sign. Okay, systolic blood pressure, the upper one, systolic and diastolic, two components will be there. If the systolic blood pressure is less than 90, then this is again a red flag sign.
And diabolic
So,
agar niche hota hai to, that's still okay. The
Pardon?
diabolic, if the diabolic is less,
Diastolic is, yes, it should be less than 60 then. Okay, normal systolic and diastolic are 120 by 80. Systolic by diastolic. But if systolic is less than 90 and diastolic is less than 60, that's a red flag sign. Immediately rush to any emergency nearby you. So
okay.
these are the vital things that one should monitor. And then apart from small logical things like whether he is active or not. Yes, we cannot open the door and see. Yes, we can video monitor him. Right? So we can talk every second hourly that how is he doing, whether he is active or not, whether he is feeling feverish. If the again, as I said, if the running of temperature spikes is more than 101 continuously, despite using medication, that's a red flag sign. So my belief is everyone must get affected with COVID, okay, to gain immunity. That sort of scenario. Almost 90% of individuals to get. That means 1.3 billion in India must get COVID. Okay, this is going to take another 1 year or 1.5 years. So please be careful. Don't be panic. Measure your vitals. And we are all always with you, okay, through Apollo teleconsultation service. And then if you are becoming sick, mildly sick, we have, isolation facilities. Apollo Kavach program is wonderfully organizing in tie-up with, a lot of, best hotels in the
city
across metros. Okay. So do avail these services. So, and remain healthy, remain panic-free. Because if you are confused, then all questions arise. If you remain stable at your thinking, then everything will be fine. And remember, only 1% of individuals, less than 1% of individuals are becoming very, very sick and requiring ICU care. Rest of the 95 to 98%, they are, invariably recovering in probably 2 weeks' time.
Right. So that's a really positive sign, and not to panic and alarm. Anita ji, आपकी कोई closing की no alcohol के अलावा, no sugar, no alcohol के अलावा कुछ और बताएंगे?
You have to really be focused. As I said, there's no one bullet for all the things. You have to build it, and it's a lifetime commitment. So eat well, be happy, sleep well, do anything which gives you happiness and positivity, and don't get alarmed. Don't panic, because that creates a lot of negative hormones in you and brings down your immunity. Just remain calm, and I think we'll tide over this phase and we'll all be fine again.
You both have made me feel really positive with the kind of situation that I'm going through. And here is the mantra: sleep well, eat well, exercise well, and relax. That's what I'm going to do. Thank you so much, both of you. Dr. Vijay Garu and Dr. Anita, thank you for being with us here. Thank you.
Thank you.
Namaste.
Namaste. And
Namaste.
Your chance to win prizes. Health quiz is something that I am going to ask 3 questions today. You have to answer the question as soon as I give you the question in the live chat box. The winner's name will be announced towards the end of the show. And winners, you need to write a mail to marketing@apollo247.com. Gift will be delivered at doorstep. I see in the comment box earlier winner, abhi aapko mila nahi hai. Definitely one of the team members will come back and check with you. So get ready. Health quiz ka first question for today. Which mineral element is required for muscle contraction? I repeat the question. Which mineral element is required for muscle contraction? Answer पता नहीं है तो quickly Google करके answer मुझे type करके भेज दीजिए. Let me see if answers have started. नहीं आया. Okay, next question. Question number 2. Feature on the Apollo 247 app allows you to take the self-assessment. I repeat the question. Which feature on Apollo 247 app allows you to take the self-assessment? Zinc is somebody's answer. Sridhar, Ladi, Jayashri, all of you have answered zinc. Reshma Mariam Santosh, you've answered calcium. So let's see which one is the right answer. And the third question for today is, which is the most active muscle in human body? The last question and the third question, which is the most active muscle in the human body? पता है तो type कर दीजिए. Vitamin C. Aha. Suresh Pega says calcium. Cuff scanner. Sridhar Kondalkar, you said cuff scanner. Self-assessment. Okay. So let's see who the winners are. In a few minutes, I'll know the winners. But as our doctors were saying, SMS, आप mask पहनिए, आप social distancing maintain कीजिए, and also have hand sanitizer ready, especially when you're going out into public spaces. Don't run out of your hand sanitizer. छोटे-छोटे bottles safety के लिए carry कर दीजिए, but don't go out of stock with your hand sanitizer. And Apollo 24/7, the pharmacy chains have come up with a larger family pack of hand sanitizer. I have a video to show you. So that's it. We are, you can order your 5 liters sanitizer, and if you're an apartment complex, if you're a shop, if you are larger community, or even at home, if you are a frequent traveler outside, this makes sense to have 5-liter hand sanitizer and then refill it from there. All right. Okay, I need to start my video, and I completely forgot about that. Yes, thank you so much for joining us on this live session today. And the winners are Reshma Mariam Santosh and Mahinder Singh. Congratulations, you are the winners, and you have to write to us to claim. Also, the third winner is Kiran Kumar Gundam Raju, I'm sorry for that. You have to write to us to claim your gift, and the gift will be delivered at the doorstep. You have to write to us at marketing@apollo247.com. Thank you so much for participating, all of you, and I thank my doctors who were here. And as a small gratification, we are giving out discount vouchers. You can use these discount vouchers on Apollo 247 app, and you can get up to 299 rupees off on consultations. And Medicine 10 is a discount voucher you can use on pharmacy orders, get 10% off on pharmacy orders. Use Apollo 247 on Apollo while booking consultations with your doctors. So thank you so much for joining us once again, and next week we shall come back with more information. Namaste, stay safe.